Hey buddies, howdy. It's Professor Suresh. Delighted to be back for my 36th video in process of publication on YouTube today, 30th of June 2020. Topic for discussion today is syndrome, types, causes and prevention. A syndrome is a set of medical signs and symptoms which are correlated with each other and often associated with a particular disease or disorder. The word derives from the Greek word meaning concurrence. In some instances, a syndrome is so closely linked with the pathogenesis or cause that the words syndrome, disease, and disorder end up being used interchangeably for them. This is especially true of inherited syndromes. For example, Down syndrome, Wolff-Hirschsprung syndrome, and Anderson syndrome are disorders with inherited syndromes. For example, Down syndrome as I said before, are disorders with known pathogenesis, so each is more than just a set of signs and symptoms, despite the syndrome nomenclature. In other instances, a syndrome is not specific to only one disease. For example, toxic shock syndrome can be caused by various toxins. Promoter syndrome can be caused by various brain lesions. And premenstrual syndrome is not a disease but simply a set of symptoms. If an underlying genetic cause is suspected but not known, a condition may be referred to as a genetic association. By definition, an association indicates that the collection of signs and symptoms occurs in combination more frequently than would be likely by chance alone. Syndromes are often named after the physician or group of physicians that discovered them or initially described the full clinical picture. Such eponymous syndrome names are examples of medical eponyms. Recently, there has been a shift towards naming conditions descriptively by symptoms or underlying cause rather than eponymously, but the eponymous syndrome names often persist in common usage. Excuse me. In medicine, a broad definition of syndrome is used, which describes a collection of symptoms and findings without necessarily tying them to a single identified pathogenesis. The more specific definition employed in medical genetics describes a subset of all medical syndromes. Psychiatric syndromes, often called psychopathological syndromes. Psychopathology refers both to psychic dysfunctions occurring in mental disorders and the study of the origin, diagnosis and development and treatment of mental disorders. Some examples of psychopathological syndromes used in modern Germany are psycho-organic syndrome, depressive syndrome, paranoid hallucinatory syndrome, obsessive compulsive syndrome, autonomic syndrome, hospitality syndrome, manic syndrome, apathy syndrome. The most important psychopathological syndromes were classified into three groups, ranked in order of severity by German psychiatrist Emil Kraepelin, 1856 to 1926. The first group, which includes the mild disorders, consists of 5 syndromes: emotional, paranoid, hysterical, delirious and impulsive. The second, intermediate group, includes 2 syndromes: schizophrenic syndrome and speech hallucinatory syndrome. The third includes the most severe disorders and consists of 3 syndromes: epileptic, oligophrenic and dementia. In Kraepelin's era, epilepsy was viewed as a mental illness. Carl Jaspers also called genuine epilepsy a psychosis and described the 3 major psychoses as schizophrenia, epilepsy and manic depressive illness. In the field of medical genetics, the term syndrome is traditionally only used when the underlying genetic cause is known. In biology, syndrome is used in a more general sense to describe characteristic sets of features in various contexts. Examples include behavioral syndromes as well as pollination syndromes and seed dispersal syndromes. In orbital mechanics and astronomy, Kessler Syndrome refers to the effect where the density of objects in low Earth orbit, shortly LEO, is high enough that collisions between objects would cause a cascade in which each collision generates space debris that increases the likelihood of further collisions. A China syndrome is a fictional scenario where a nuclear meltdown melts through a reactor containment vessel and then all the way through the Earth to the opposite side. There is no set common convention for the naming of newly identified syndromes. In the past, syndromes were often named after the physician or scientist who would identify and describe the condition in an initial publication. These are referred to as eponymous syndromes. In some cases, diseases are named after the patient who initially presents with symptoms or their hometown. Stockholm Syndrome, for example. There have been isolated cases of patients being eager to have their syndromes named after them while the physicians are hesitant. When a syndrome is named after a person, there is some difference of opinion as to whether it should take the possessive form or not. Down syndrome versus Down's syndrome. Most common disorders are 1. P. Point mutation or any insertion, deletion entirely inside one gene. 2. D. For deletion of a gene or genes. 3. C. Whole chromosome extra, missing, or both. 4. T. Trinucleotide repeat disorders. Gene is extended in length. Historically, the concepts of health promotion and disease prevention have been closely related. According to World Health Organization, shortly WHO, health promotion is a process of enabling people to increase the control over their health and improve it. It refers to any activity destined to help people to change their lifestyle and move towards a state of optimal health. Health promotion can be facilitated through a combination of efforts aimed at raising awareness, changing behaviors, and creating environments that support good health practices, healthy public policies, and community development. The concept of disease prevention is more specific and comprises primary, secondary, and tertiary prevention. Primary prevention is defined as preventing the disease or stopping individuals from becoming at high risk. Universal and selective preventive interventions are included in primary prevention. Universal primary prevention targets the general public or a whole population group without an identified specific risk. That example, iodine supplementation programs to prevent neurological and other disorders caused by iodine deficiency, like goiter. Selective primary prevention targets individuals or subgroups of the population whose risk of developing the disease is significantly higher than average, as evidenced by biological, psychological, or social risk factors. Example, prevention of stroke through adequate management of hypertension, diabetes, and hypercholesterolemia. Secondary prevention aims at decreasing the severity of disease or reducing the risk level or halting progression of disease through early detection and treatment of diagnosable diseases causes. Example, ensuring drug compliance in the treatment of epilepsy, for instance. Tertiary prevention includes interventions that reduce premature death and disability, enhance rehabilitation, and prevent relapses and recurrence of the illness. Rehabilitation may mitigate the effects of disease and thereby prevent it from resulting in impaired social and occupational functioning. It is an important public health intervention that has long been neglected by decision makers. Moreover, rehabilitation is an essential aspect of any public health strategy for chronic diseases long term, including a number of neurological disorders and conditions such as multiple sclerosis, Parkinson's disease, and the consequence of stroke or traumatic brain injury. Focusing on risks to health is a key to preventing any disease or injury. Many factors are relevant in prioritizing strategies to reduce risks to health. These include the extent of the threat posed by different risk factors, the availability of cost-effective interventions, and societal values and preferences. Risk assessment and estimates of the burden of disease resulting from different risk factors will be altered by many different strategies. Prevention strategies and interventions designed to reduce or prevent a particular disease are of two types. In population or mass approaches, a whole population is asked to be involved in modifying their behavior in some way, example being immunized against poliomyelitis. Even presently, because of COVID-19, What is a preventive measure? What are the preventive measures? One has to wear mask, maintain social distancing, maintain proper personal hygiene like washing the hands frequently, etc. In targeted or high risk approaches, only high risk individuals are involved, which necessitates some form of screening to identify those who are at high risk. Example, HIV testing. Many neurological disorders and conditions affect an individual's functioning and result in disabilities or limit activities and restrict participation. According to the International Classification of Functioning, shortly ICF, disability and health, the medical model views disability as a problem of the person directly caused by the disease, trauma, or other health condition that requires medical care provided in the form of individual treatment by professionals. The social model of disability sees the issue mainly as a socially created problem and a matter related to the full integration of individuals into society. According to the social model, disability is not an attribute of the individual, but rather a complex collection of conditions, many of which are created by the social environment. The approach to disability requires social action and is a collective responsibility of society. Actually, people with disabilities do not like to be considered as disabled persons. They do not like to be treated as a special person. They want to lead normal life. That gives them that, superiority complex, whatever. Who defines rehabilitation as an active process by which those affected by injury or disease achieve a full recovery, or if a full recovery is not possible, realize their potential, optimal physical, mental and social potential, and are integrated into their most appropriate environment. As a healthcare strategy, rehabilitation aims to enable people who experience or are at a risk of disability to achieve optimal functioning, autonomy and self-determination in the interaction with a larger physical, social and economic environment. Rehabilitation involves a coordinated and iterative problem-solving process along the continuum of care from the acute hospital in the community. It is based on 4 key approaches, integrating a wide spectrum of interventions: biomedical and engineering approaches that build on and strengthen the resources of the person, approaches that provide for a facilitating environment, and approaches that provide guidance across services, sectors and players. Specific rehabilitation interventions include those related to physical medicine, pharmacology and nutrition, psychology and behavior, education and counseling, occupational and vocational advice, social and supportive services, architectural and engineering, and other interventions. Rehabilitation services are like a bridge between isolation and exclusion, often the first step towards achieving fundamental rights. Health is a fundamental right, and rehabilitation is a powerful tool to provide personal empowerment. The rehabilitation cycle involves 4 steps: assess, assign, intervene, and evaluate. The same order, same sequence. The process is applied on 2 levels. The first refers to the guidance along the continuum of care, and the second to the provision of a specific service. From the guidance perspective, the assessment step includes the identification of the person's problems and needs, the evaluation of rehabilitation potential and prognosis, and the definition of long-term service and goals of the intervention program. The assignment step refers to the assignment of a service and an intervention program. From the guidance perspective, the intervention step is not further specified. The evaluation step refers to service and the achievement of the intervention goal. Rehabilitation should start as soon as possible after the diagnosis of a neurological disorder or condition and should focus on the community rehabilitation perspective. The type and provision of services is largely dependent on the individual healthcare system. Therefore, no generally agreed principles currently exist regarding the provision of rehabilitation and related services. Stigma has been defined as a deeply discrediting attribute that reduces a person to one who is in some way tainted and can therefore be denigrated. They don't feel their self-worth. It is a pervasive problem that affects health globally, threatening an individual's psychological and physical well-being. It prevents individuals from coming forward for diagnosis and impairs their ability to access care or participate in research studies designed to find solutions. In most of the syndromes affect the brain, really. In neurology, stigma primarily refers to a mark or characteristic indicative of a history of neurological disorder or condition and a consequent physical or mental abnormality. For most chronic neurological disorders, the stigma is associated with a disability rather than the disorders per se. Important exceptions are epilepsy and dementia. Stigma plays an important role in forming the social prognosis of people with these disorders. The amount of stigma associated with a chronic neurological illness is determined by two separate and distinct components: the attribution of responsibility for the stigmatizing illness and the degree to which it creates discomfort in social interactions. An additional perspective is a socially structured one, which indicates that stigma is part of chronic illness because individuals who are chronically ill have less social value than healthy individuals. Chronic, as I said, long term. Stigma leads to direct and indirect discriminatory behavior and factual choices by others that can substantially reduce the opportunities for people who are stigmatized. Stigma increases the toll of illness for many people with the brain disorders and their families. It's a cause of disease as people who are stigmatized high exposure to health risks and low access to protective factors and treatment. Sometimes coping with the stigma surrounding the disorder is more difficult than living with any limitations imposed by the disorder itself. Stigmatized individuals are often rejected by neighbors and the community, and as a result suffer loneliness and depression. The psychological effect of stigma is a general feeling of unease or of not fitting in, loss of confidence, increasing self-doubt, leading to depreciated self-esteem, that's what I said before, and there is general alienation from the society. So see to that it does not happen to anybody. Moreover, stigmatization is frequently irreversible, so that even when the behavior or physical attributes disappear, individuals continue to be stigmatized by others and by their own self-perception. In so many ways it is similar to trauma, I would say. The effects are long-lasting. So many times it is tough to reverse the effects of those things. The efforts are needed to reduce stigma, but more importantly to tackle the discriminatory attitudes and prejudicial behavior that give rise to it. Fighting stigma and discrimination requires a multi-level approach involving education of health professionals and public information campaigns to educate and inform the community about neurological disorders in order to avoid common myths and promote positive attitudes. Treatment for attention deficit hyperactivity disorder, shortly ADHD or shortly ADD, is not just about taking medication. There are many other effective treatments that can help kids with attention deficit hyperactivity disorder improve their ability to pay attention, control impulsive behavior, and curb hyperactivity. Nutritious meals, play and exercise, learning new coping skills, and improving social skills are all part of a balanced treatment plan that can improve your child's performance at school, bolster the relationship with others, and decrease the stress and frustration for them and for your whole family. Stimulants such as Ritalin and Adderall are often prescribed for ADHD, but they might not be the best option for your child, and they are certainly not the only treatment. Medications for ADHD may help your child concentrate better or sit still, at least in the short term. Actually, medication should be avoided as much as possible. The focus should be on prevention and family support, exercise, changing the mindset, psychological counseling. Those kind of things will go a long way. But to date, there is little evidence that they improve school achievement, relationships, or behavioral issues over the long term. And even in the short term, medication won't solve all problems or completely eliminate the symptoms of ADHD. That's what I said. And moreover, the allopathy medicines, or so-called English medicines, have so many side effects. So, as much as possible, avoid going for allopathy treatment. Go for natural treatment, what is called as naturopathy, Ayurveda, Yoga, Siddha, Unani, those kind of things. At least those things, even if it doesn't have the desired effects, it won't have unwanted adverse side effects. Some people get addicted to the medicines also later. Especially painkillers are administered to patients that have chronic pain. Later they get addicted. Furthermore, there are concerns about the effects these powerful drugs may have on a child's developing brain. And the side effects such as irritability, loss of appetite, and insomnia can also be problematic. People that are sleep deprived use barbiturates and all that. Later on it becomes an addiction. They cannot get out of it. So avoid it. The bottom line, medication is a tool, not a cure. Yoga, meditation and all originated from our country. So practice those things. That leads to a lot of stress reduction, relaxation for the mind, whatever. That helps in a lot of ways. Some children experience dramatic improvement while others experience little to no relief. The side effects also differ from child to child, and for some they far outweigh the benefits. Because everyone responds differently, finding the right medication and dosage takes time. Medication for ADHD is more effective when combined with other treatments, as I emphasized again and again. ADHD medication should always be closely monitored. If you choose to put your child on medication, that does not mean they have to stay on it forever. As a parent, you have a huge influence over your child's treatment. Evidence shows that eating a healthy diet, getting plenty of exercise, and making other smart daily choices can help your child manage the symptoms of ADHD. See, what I said is true. That means your child can begin treatment for ADHD today at home. Studies show spending time in nature can reduce the symptoms of ADHD in children. Live in harmony with nature, not ruin the nature. Don't ruin the forest, animal life, whatever. Then blame the animals as if they enter into this thing. We have occupied their land. It is not intrusion by the animals, it is intrusion by the human beings in wildlife. Encourage your child to play outside for at least 30 minutes each day. That is not happening now. If possible, people are addicted to the electronic gadgets that affects the eyes, mind, everything. They are socially isolated also. They become like nuts. Exercising is one of the easiest and most effective ways to reduce the symptoms of ADHD. Physical activity immediately boosts the brain's dopamine, norepinephrine, and serotonin levels, all of which affect focus and attention. Hormones. Exercise does not require a prescription and it's free of side effects. Do you need any prescription for walking, jogging, running and all that? Or working out in the gym? Activities that require close attention to body movements such as dance, gymnastics, martial arts and skateboarding are particularly good for kids with ADHD. Aerobics is damn good. Team sports are also a good choice. The social element keeps them interesting. Regular quality sleep can lead to vast improvement in the symptoms of ADHD. Good nutrition can help reduce the ADHD symptoms. Behavioral therapy, also known as behavior modification, has been shown to be a very successful treatment for children with ADHD. I forgot to mention about nutrition. Always eat balanced food. Don't eat junk food, especially the sodas, chips, processed food, sweets, chocolates, coffee. It's all very bad for the health. Pizza, burger, then what is it? Most of the Western food is real junk food. It is especially beneficial as a co-treatment for children who take stimulant medications and may even allow you to reduce the dosage of the medication. Behavioral therapy involves reinforcing desired behaviors through rewards and praise and decreasing problem behaviors by setting limits and consequences. According to American Academy of Pediatrics, there are three basic principles to any behavior therapy approach. First, set specific goals. Second, provide rewards and consequences. Third, keep using the rewards and consequences. Patience is key with the behavioral therapy. You cannot don't expect dramatic results overnight, since people with ADHD are notoriously variable in their symptoms. One day a child may behave beautifully and the next day fall back into old patterns. It's all dynamic. Sometimes it may seem as if the training is not working. However, over time, behavioral treatment does improve the symptoms of ADHD. Another type of treatment that can help is social skills training, normally conducted in a group setting. Social skills training are led by a therapist who demonstrates appropriate behaviors and then as the children practice repeating them. The social skills group teaches children how to read others' reactions and how to behave more acceptably. The social skills group should also work on transferring these new skills to the real world. Children with ADHD are more likely to succeed in completing tasks when the tasks occur in predictable patterns and in predictable places, so that they know what to expect and what they are supposed to do. As we establish a consistent structure and routine, keep in mind that children with ADHD often receive criticism. Be on the lookout for good behavior and praise it. Praise is especially important for children who are ADHD because they typically get so little of it. Everybody likes to be praised. They don't like to be blameworthy. They like to be praiseworthy. It need not be only for children and others. The same concept holds true for everybody. A smile, a positive comment, or other reward from you can improve your child's attention, concentration, and impulse control. Do your best to focus on giving positive praise for appropriate behavior and task completion while giving as few negative responses as possible to inappropriate behavior or poor task performance. Reward your child for small achievements. These will lead to bigger successes down the road. Autism used to be a rare disorder, so that the majority of doctors never saw it in their practice and most people had never heard of it. 15 years ago in Western countries, the incidence of autism used to be on average one child in 10,000. Now, according to the UK Department of Health, 1 in 166 children in Great Britain are diagnosed with autism. According to the USA Center for Disease Control, shortly CDC, around 1 out of 150 American children are diagnosed with autistic spectrum disorders now, and the numbers are growing every day. These figures are bold, whatever I quoted. Similar numbers are reported by the Autism Canada Foundation. Hundreds of autistic children across the globe, appropriately treated and educated, become almost indistinguishable from the typically developing normal peers. The sooner the treatment starts, the better are the results. Because the younger the child is, the less damage there is to undo, and also because they have less catching up to do in the development with the normal children of their age. Thankfully, the medical professionals, though often being unhelpful as far as treatment is concerned, are much better nowadays at diagnosing autism. The majority of children get diagnosed by the age of 3, which was not the case 10 to 15 years ago. Receiving the diagnosis so early gives the parents a chance to start acting early, which gives the child a better chance of recovery. Attention deficit disorder with hyperactivity and without it, shortly ADHD and AD, as I said before, dyspraxia, dyslexia, various behavioral and learning problems, allergies, asthma, eczema, all have reached. Epidemic proportions, but more than that, these seemingly unrelated conditions overlap with each other. Such kids develop digestive disorders. This can be called as gut and psychology, shortly GAP syndrome. Apart from childhood learning disabilities, autism, ADHD or AD, dyslexia, dyspraxia and various learning and behavioral problems, there is another group of conditions which fit into the GAP syndrome. These conditions are schizophrenia, depression, manic depression or bipolar disorder, and obsessive compulsive disorder. GAPS, children and adults have digestive problems, sometimes quite severe. Colic, bloating, flatulence, diarrhea, constipation, feeding difficulties, and malnourishment, all to various degrees are a typical part of autism, schizophrenia, and other GAPS conditions. Unstable angina was a well-defined syndrome recognized as being responsible for a significant amount of disability and death, and termed acute coronary syndromes, shortly ACS, to cover the full spectrum of severity of the disease process, and the clinical manifestations from unstable angina, shortly UA, to non-ST segment elevation myocardial infarction, shortly NST-EMI, ST segment elevation myocardial infarction, shortly ST-EMI, and sudden death syndrome. Neurotypical, shortly NT syndrome, is a neurobiological disorder characterized by preoccupation with the social concerns, delusions, or superiority and obsession with conformity. Neurotypical individuals often assume that the experience of the world is either the only one or the only correct one. NTs find it difficult to be alone. NTs are often intolerant of seemingly minor differences in others. When in groups, NTs are socially and behaviorally rigid and frequently insist upon the performance of dysfunctional, destructive, and even impossible rituals as a way of maintaining group identity. All of you must have heard about that environmental activist Greta Thunberg in Sweden. She is suffering from neurotypical syndrome. NTs find it difficult to communicate directly and have a much higher incidence of lying as compared to persons on the autistic spectrum. Autism is also known as Asperger's syndrome. There are several other types of bipolar disorder. Each type is identified by the pattern of episodes of mania and depression. Bipolar 1 disorder is a classic form of the illness as well as the most severe type of bipolar disorder. It is characterized by at least one manic episode or mixed episode. The vast majority of people with bipolar disorder 1 disorder have also experienced at least one episode of major depression. Mania is not involved in bipolar 2 disorder. Instead, the illness involves recurring episodes of major depression and hypomania, a milder form of mania. Hypo is low, hyper is high. Cyclothymia is a milder form of bipolar disorder. Like bipolar disorder, cyclothymia consists of cyclical mood swings. However, the highs and lows are not severe enough to qualify as either mania or major depression. Bipolar disorder is commonly misdiagnosed as depression, since most people with bipolar disorder seek help when they are in the depressive stage of the illness. When they are in the manic stage, they don't recognize the problem. What's more, most people with bipolar disorder are depressed a much greater percentage of the time than they are manic or hypomanic. A comprehensive treatment plan for bipolar disorder aims to relieve the symptoms, restore your ability to function, fix the problems the illness has caused at home and at work, and reduce the likelihood of recurrences. A comprehensive bipolar treatment plan involves medication, psychotherapy, education, lifestyle management, and support. The mucopolysaccharidosis (MPS) are inherited metabolic disorders caused by genetic defects that result in the absence or severe deficiency of one of the lysosomal hydrolases responsible for the degradation of glycosaminoglycans, shortly GAGs, part of the group of lysosomal storage disorders, LSDs, not the LSD that you are thinking of, not the, what is it? All MPSs are autosomal recessive with the exception of Hunter syndrome or MPS2, which is an X-linked recessive disease. Hunter syndrome is caused by LSD narcotic. Syndrome is caused by a deficiency of iduronate 2 sulfatase I2S EC 3.1.6.13, which normally cleaves a sulfate group from the CAGs heparan, and dermata and sulfate. The storage of I2S leads to an accumulation of undegraded CAGs within the lysosomes of various organs and tissues, including the central nervous system, shortly CNS. The abnormal deposition of CAGs alters the architecture of and function of cells and tissues, resulting in dysfunction of multiple organs and systems, producing a broad spectrum of chronic and progressive clinical manifestations. From a neurological perspective, approximately 2/3 of patients have psychomotor retardation, behavioral disturbance, and neurological regression. Oppositional defiant disorder, shortly ODD, is one of a group of behavioral disorders called disruptive behavior disorders, shortly DBD. These disorders are called this because children who have these disorders tend to disrupt those around them. ODD is one of the more common health disorders found in children and adolescents. I am smiling because one of my relatives has it. Physicians define ODD, very close relative, as a pattern of disobedient, hostile, and defiant behavior directed toward authority figures. Authority means the higher ups at work or the elder ones at home. Some people do not understand what authority means here. Children and adolescents with ODD often rebel, are stubborn, argue with adults, and refuse to obey. They have angry outbursts and have a hard time controlling their temper. They have to reduce the salt intake, sodium chloride. They become hypertensive. Even the best behaved children can be uncooperative and hostile at times, particularly adolescents. But those with the ODD show a constant pattern of angry and verbally aggressive behaviors, usually aimed at parents and other authority figures. The most common behaviors that children and adolescents with ODD show are defiance, spitefulness, negativity, hostility, and verbal aggression. This disorder is often accompanied by other serious mental health disorders, and if left untreated can develop into conduct disorder, shortly CD. A more serious disruptive behavior disorder. Children with ODD who are not treated also are at an increased risk of substance abuse and delinquency. Treatment really consists of a combination of therapies including behavioral therapy, parent training, and family therapy. Some children may benefit from medication as well. ODD usually appears in late preschool or early school age children. In younger children, ODD is more common in boys than girls. However, in school age children and adolescents, the condition occurs about equally in both boys and girls. Although the disorder seems to occur more often in lower socio-economic groups, ODD affects families of all backgrounds. Parkinson's disease, shortly PD, is a common neurodegenerative disorder affecting the patients in large number throughout the world. Parkinson's disease is referred to in the ancient medical system of Ayurveda under the name Kampavata, which is characterized by Kampa, tremors, stamba, rigidity, chestahani, akinesia, and gati vikriti, gait disorders. Occasional injuries are part of the human experience, and healing is the body's self-repair process. Healing begins with inflammation, which nature uses to clean up the damaged. Chronic inflammation is a consequence of an injury to the body combined with the neurological, nutritional imbalances, deficiencies, tissues, and protect against the infection. Most of us understand inflammation as something that causes redness, tenderness, stiffness, and pain. It is a core of inflammatory disease, and it also is intertwined in every disease, including obesity, diabetes, and multiple sclerosis. It is body's natural way of fighting against the disease. It is because of the immunity we have. It is the white corpuscles in the blood that fight against the infections. Inflammation is a normal process that can go dreadfully wrong. It is supposed to protect us from infections and promote healing when we are injured. Yet chronic inflammation does just the opposite. It breaks down our bodies and makes us more susceptible to the disease. That is element. Inflammation forces millions of people with arthritis to alter their daily lives, and it compels millions of people with asthma to be cautious because they do not know when the next suffocating attack will occur. A syndrome is a group of symptoms that characterizes a particular disorder, as I mentioned at the beginning. Similarly, the inflammation syndrome reflects the coexistence of at least two and often more inflammatory disorders that greatly increase the risk of developing more serious inflammatory diseases. The excess weight contributes to inflammation because fat cells secrete chemicals such as interleukin 6 and C-reactive protein that promote inflammation. Having diabetes also heightens your chances of suffering from periodontitis, a type of dental inflammation. The gums and all will swell up. I don't know how many of you have experienced it. Allergies stir up the inflammatory response, which may give rise to inflammation account for an estimated 30% of cancers. Joint injuries frequently put an inflammatory response into motion, setting the stage for osteoarthritis. Serious head injuries and the resultant brain inflammation increase the long-term risk of developing Alzheimer's disease, which is also being viewed by doctors as an inflammatory process affecting the brain cells. Unless inflammatory problems are controlled or reversed, they tend to get worse, creating a cascade. You know, cascade? Like a chain, one after the other, that leads to more serious inflammatory diseases, such as coronary heart disease and Alzheimer's. Obsessive compulsive disorder, OCS, is a mental disorder in which a person feels the need to perform certain routine tasks repeatedly, called as compulsions, or as certain thoughts repeatedly, called as obsessions. The person is unable to control either the thoughts or activities for more than a short period of time. Obsessive compulsive disorder, OCD, is characterized by unreasonable thoughts and fears that lead to compulsive behaviors. OCD often centers on themes such as fear of germs or the need to arrange objects in a specific manner. Most of us have OCD, especially who expect perfection in real life. Neatness, perfection. Treatment includes talk therapy, medication, or both. Human immunodeficiency virus, shortly HIV, infection and acquired immune deficiency syndrome, shortly AIDS, is a spectrum of conditions caused by infection with HIV. There is a theory it's a biowar actually. AIDS was spread from a lab with ulterior motives. HIV spreads primarily by unprotected sex, contaminated blood transfusions, hypodermic needles, and from mother to child during pregnancy, delivery, or breastfeeding. HIV is a member of a group of viruses known as retroviruses. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fever can occur. Fever is really also. Then the disease is asymptotic until it progresses to AIDS. AIDS symptoms include unexplained weight loss, fever or night sweats, fatigue, and recurrent infections. The body loses the immunity, basically. Attention deficit disorder, ADS, is a neurological disorder that causes a range of neurological problems such as difficulty attending to instruction, focusing on schoolwork, keeping up with assignments, following instructions, completing the tasks, and social interaction. It may contribute to low self-esteem, troubled relationships, and difficulty at school or work. Symptoms include limited attention and hyperactivity. Treatment includes medication and talk therapy. Most of Generation Z, born after the year 1995 through 2012, and even after that, have attention deficit syndrome. For syndromes like AIDS, there is no permanent cure like cancer. AIDS can be prevented but not cancer, since the root causes are still an enigma. Whatever I have stated are based on my personal experiences so far in my life. Debates, discussion on topics like this can go on forever. Anyhow, it's a long day. Let me call it a day. We'll meet again real soon. Rest in peace and harmony. Always watch these videos with a closed caption, subtitles for absolute 100% comprehension as per my persistent recommendation. I know I rushed through to complete the presentation within 20 minutes max, There's a time limit. I had set myself to retain the viewer's attention as a norm. I know nowadays I exceed this time limit since I make honest attempts to cover the selected topic more elaborately, including so many intricate details, fine details, referring a wide variety of sources, in particular Wikipedia extensively, besides articles and books published recently. Stay at home as much as possible to maintain social distancing attributed to pandemic novel COVID-19 and prolong your lifespan. I don't know how long we need to live like this. They say it will become a part and parcel of our regular life. There is no relief. Lead a healthy life. God alone can put a stop to natural, unnatural, maybe bio-war and cyber-war events like pandemics, which may lead to apocalypse and extinction of all sentient species on earth. I know this is my longest presentation so far, my 36th presentation. I couldn't help it. Okay, all the best. Peace.